Good afternoon. Welcome to Kenya News Update today. I'm your host, and we begin with a major development in Kenya's public health landscape. This Wednesday, February 18th, 2026, Health Cabinet Secretary Aden Duale announced that Kenya has received its first shipment of a groundbreaking new tool in the fight against HIV, 21,000 starter doses of the injectable prevention vaccine, lenacapavir. This shipment marks the beginning of a phased rollout in priority counties, with additional supplies expected in the coming weeks. This is a significant moment, representing a potential paradigm shift from daily pills to biannual injections for HIV prevention. But this story is not just about a medical delivery. It's a complex narrative woven with threads of public health strategy, global pharmaceutical dynamics, and the ever-present tension between technological advancement and civil liberties. Over the next 12 minutes, we will dive deep into what this vaccine means for Kenya, who will get it first, the science behind it, and the broader context of a nation navigating innovation on multiple fronts. Let's begin with the announcement itself. At a press briefing at 10 a.m. this morning, CS Duale stood before the cameras to make the historic announcement. Kenya has received 21,000 starter doses of lenacapavir, he stated, confirming the delivery of the long-acting injectable. The vaccine, developed by the American pharmaceutical giant Gilead Sciences, is administered just twice a year. This stands in stark contrast to the current standard of care for pre-exposure prophylaxis, or PrEP, which involves taking a daily oral pill. The initial rollout will target what the Ministry of Health has designated as priority counties. While the full list wasn't disclosed, sources indicate these are likely regions with the highest HIV incidence rates, potentially including Homa Bay, Siaya, Kisumu, and Migori counties, which have historically borne a disproportionate burden of the epidemic. The ministry's stated goal is ambitious: to significantly reduce new HIV infections, which currently stand at an estimated 32,000 annually, by targeting key populations with this more convenient prevention method. To understand the potential impact, we need to look at the current HIV landscape in Kenya. According to the latest data from the National AIDS Control Council, approximately 1.4 million people in Kenya are living with HIV. Of these, about 1.2 million are on life-saving antiretroviral therapy. On the prevention front, around 220,000 individuals are currently using oral PrEP. However, adherence, taking the pill every single day, remains a major challenge, with studies suggesting discontinuation rates can be as high as 50% within 6 months. This is where lenacapavir promises a revolution. By requiring only 2 injections per year, it removes the burden of daily pill taking. Clinical trials have shown it to be highly effective, with the efficacy rate exceeding 99% in preventing HIV acquisition when administered as scheduled. The target for this initial batch of 21,000 doses is clear: to inoculate 10,500 individuals, as each person requires 2 starter doses administered 2 months apart before moving to the biannual schedule. However, the arrival of this vaccine is not happening in a vacuum. It comes amidst a heated global debate about access and equity. Lenacapavir is patented and produced by Gilead, a company often criticized for the high prices of its HIV drugs. The cost of this initial shipment has not been made public, but analysts estimate the global list price for a year's supply could be around 500,000 shillings per person. Kenya's procurement, likely negotiated through a combination of government funding and support from international partners like PEPFAR and the Global Fund, is a critical first step. But the question of long-term sustainability looms large. Can the Kenyan government, which allocated 4.2 billion shillings to the HIV response in the 2025/2026 budget, afford to scale this up to the hundreds of thousands who could benefit? This debate pits the undeniable clinical benefits against harsh fiscal realities. Proponents argue that preventing an infection is ultimately cheaper than a lifetime of treatment, which costs the system approximately 50,000 shillings per patient per year. Critics, however, worry that investing in a high-tech solution for a few could divert resources from broader, community-based prevention programs that reach millions. Let's examine the rollout strategy more closely. The Ministry of Health has established a 120-person national task force to oversee the vaccine's introduction. This team, comprising clinicians, logisticians, and community advocates, is tasked with a monumental job: The vaccine itself requires specific cold chain storage at between 2 and 8 degrees Celsius, posing a significant logistical challenge for last-mile delivery to remote health facilities. Training for healthcare workers is already underway in 5 regional hubs, with a goal of certifying 800 providers within the first quarter. The selection criteria for the first 10,500 recipients are stringent. Priority will be given to individuals at the highest risk of HIV infection, including serodiscordant couples, where one partner is HIV positive and the other is not, female sex workers, and people who inject drugs, groups that have historically faced barriers to consistent PrEP use. The application process involves a thorough medical screening and counseling session at designated facilities. This targeted approach is designed to maximize impact, but inevitably raises questions about fairness and access for the general population. Now, let's pivot to a related but distinct issue that underscores the complex relationship between technology, governance, and individual rights in modern Kenya. As we discuss a medical technology arriving to protect health, another form of technology is reportedly being used in ways that threaten privacy. A recent report from the University of Toronto's Citizen Lab claims that Kenyan authorities use surveillance software from the Israeli firm Celebrite to extract data from the phone of prominent activist and 2027 presidential aspirant Boniface M1G while he was under arrest last July. This alleged incident did not occur in isolation. According to digital rights groups, there have been at least 15 documented cases over the past 18 months where activists, journalists, and opposition figures have had their devices compromised using similar tools. The software in question, Celebrite's Universal Forensic Extraction Device, or UFED, can bypass phone encryption, extract messages, photos, call logs, and even deleted data. This creates a fascinating, if troubling, juxtaposition. On one hand, the government is embracing cutting-edge biotechnology to safeguard public health. On the other, it is allegedly deploying cutting-edge digital technology to surveil its critics. The Ministry of Interior has repeatedly denied any misuse of surveillance tools, stating they are used strictly for legitimate national security investigations. However, the lack of a comprehensive data protection law with strong oversight mechanisms leaves a gray area. Digital rights advocates argue that without clear judicial warrants and transparency, such tools can be easily abused to stifle dissent, especially in a charged political environment ahead of the 2027 elections. This dual narrative of Kenya as a hub for health innovation and a potential testing ground for intrusive surveillance paints a picture of a nation at a technological crossroads. Returning to the HIV vaccine, the scientific community in Kenya is largely optimistic but cautious. Dr. Evelyn Wanjiru, an infectious disease specialist at the Kenya Medical Research Institute, calls it a game changer. She points to the high efficacy and convenience as key to overcoming the adherence barrier. For many of my patients, hiding a daily pill from a partner or family is a constant stress. An injection every 6 months is discreet and removes that burden, she explains. However, other experts sound notes of caution. Dr. Paul Omondi, a public health economist, raises concerns about technology creep. He asks, will we now see a two-tiered prevention system? The wealthy and well-connected in urban centers get the advanced injection, while the rural poor are left with pills that are harder to stick to. He also highlights the need for robust pharmacovigilance to monitor for any long-term side effects, which are not yet fully understood. The vaccine is still relatively new, having received its first global regulatory approval only in late 2025. The financial implications are staggering. Scaling up from 10,500 people to, say, 100,000 high-risk individuals would require an estimated 5 billion shillings per year for the vaccine alone, not including delivery and personnel costs. This is more than the entire current annual budget for all HIV prevention programs. This forces a difficult conversation about priorities. Should the state pursue an efficiency model, targeting a small, high-risk group with the most effective tool, or an AQT model, spreading resources more thinly to cover a much larger portion of the at-risk population with oral PrEP and other interventions? There is no easy answer. Proponents of the vaccine argue that its higher efficacy justifies the cost for those who need it most. Critics counter that strengthening the broader healthcare system, improving clinic access, fighting stigma, and ensuring consistent condom supply would benefit far more people for the same investment. This debate is mirrored in the digital surveillance discussion. Proponents of tools like Celebrite's argue they are essential for modern law enforcement to combat serious crime and terrorism. They point to successes in disrupting trafficking rings and solving complex cases. Opponents see a slippery slope towards authoritarianism, where the tools meant to protect citizens are turned against them. The alleged targeting of a presidential candidate like Boniface Mwangi, they argue, is a clear red flag. It suggests the technology could be used for political espionage rather than public safety. This creates a fundamental question for Kenya, under President William Ruto's administration: how to harness powerful technologies for public good while erecting firm guardrails to prevent their abuse. The parallel is striking. Both in medicine and in security, Kenya is gaining access to powerful new tools whose ultimate impact depends entirely on the wisdom, transparency, and equity with which they are deployed. Looking ahead, the next steps for the HIV vaccine are clear. The Ministry of Health plans to launch a public awareness campaign next month, aiming to reach 5 million people with information about lenacapavir. The first injections are scheduled to be administered in early April at 30 selected facilities across the priority counties. The government has also committed to establishing a real-time monitoring dashboard to track rollout progress, adverse events, and demographic data of recipients. Success will be measured not just by the number of injections given, but by the infection rate among the vaccinated cohort over time. The goal is to demonstrate a measurable drop in new infections in the priority counties within 2 years, providing a compelling case for further investment and expansion. In conclusion, the arrival of 21,000 doses of the lenacapavir vaccine is a landmark event for Kenya. It represents hope for a future with fewer HIV infections and less stigma around prevention. It showcases Kenya's capacity to adopt and implement advanced global health solutions. Yet, this story is inextricably linked to the larger narrative of Kenya's journey in the 2020s, a nation eagerly embracing technological solutions while grappling with the profound ethical, financial, and social questions they inevitably raise. From a life-saving injection administered twice a year to software that can extract a life's worth of data from a phone in minutes, Kenya is navigating uncharted territory. The choices made today about who gets the vaccine, how surveillance tools are regulated, and where the line is drawn between innovation and intrusion will shape the nation's health and its democracy for years to come. The promise of technology is immense, but its guardianship is a responsibility of equal magnitude. For Kenya News Update Today, I'm your host. Subscribe to Kenya News Update Today.